Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as mefenamic acid. Its brand name is ponstan. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We're going to start by talking about how ponstan works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe ponstan, then examples of dosing, and then stick around to the end where we'll talk about side effects. So how does ponstan work? Well, first of all, it's a non-steroidal anti-inflammatory drug, or an NSAID, and its mechanism of action is thought to be related to prostaglandin synthetase inhibition. Now, in terms of indications, we would typically see this medication prescribed during dysmenorrhea or painful menses, and it can also be used to treat acute, mild to moderate pain. Now, for contraindications or reasons we would not be able to prescribe ponstan, we would typically see a contraindication if a patient had a hypersensitivity to ponstan or any other component of the formulation. If a patient had a history of asthma, urticaria, or allergic type reactions following aspirin or NSAID administration, they would not be able to use this medication. And it would also be contraindicated surrounding a CABG or coronary artery bypass graft surgery. Now, what about dosing with ponstan? So in dysmenorrhea, we would typically see 500 milligrams orally initially, followed by 250 milligrams every 6 hours. They would begin at the onset of bleeding or symptoms and then continue for about 2 to 3 days. When treating mild to moderate pain, the dosing would be similar in that you would use 500 milligrams orally initially, followed by 250 milligrams every 6 hours as needed this time. And then the typical duration would be 1 week of therapy, limited to 1 week of therapy, rather than the 2 to 3 days. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using ponstan, so I'll go over some of those here now. All these side effects here fall in a range between 1% and 10% of patients that would experience them. So pruritus or itchiness of the skin, rash, abdominal pain, some patients may experience constipation or diarrhea, even flatulence. Other patients may experience heartburn or indigestion. Nausea and vomiting may occur in some patients, as well as dizziness or a headache. Now, some more rare but serious side effects would be hypertension or high blood pressure, hyperkalemia or high potassium levels, or an exacerbation of asthma. That's all we're going to talk about today with mefenamic acid or ponstan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.